In March 2018, Worcestershire had a local area SEND inspection. This was undertaken jointly by Ofsted and the Care Quality Commission. The inspection raised significant concerns about the effectiveness of the local area. The local area was required to submit a written statement of action to Ofsted to detail how areas of significant weakness could be addressed. In 12 areas were identified and are known as the 12 key concerns. These are being addressed through the SEND Improvement Programme, a multi-agency programme involving SEND services, social care, health and education providers. Since 2018, we've made necessary improvements to address the 12 key concerns, and we wanted to share how we know we are making the necessary improvements, including a positive impact on families and children with SEND in Worcestershire. Key concern 1, safeguarding concerns regarding long-term part-time timetables being removed from roll and tracking of CYP from London boroughs housed locally. Safeguarding concerns were raised, specifically the use of part-time timetables, children and young people being removed from school roll, and tracking of vulnerable children housed in the local area by London boroughs. There was a lack of strategic oversight in this area. The work we have done in this area, such as multi-agency meetings, Missing Monday, working with the schools through SENCO networks and gathering of data, is enabling us to identify, assess and act earlier to reduce the risk from children missing education. There is now a much improved sharing of information from London boroughs, meaning that the local area is informed and prepared for children when they arrive in the county. This greater knowledge and improved multi-agency working means there are fewer opportunities for children to slip through the net and be missing from education. Children Missing Education officers continue to track all inquiries to ensure education is secured for each child. Missing Monday meetings continue, as well as Vulnerable Links Group, which meet fortnightly to track specific groups of children. There has been a 29% decrease in the number of children missing education in Worcestershire since 2018-2019 year end, and the Department for Education have recognised that there is now strategic oversight in this area. Key concern 2, clinical commissioning groups' lack of strategic leadership implementing SEND reforms. Key concern 2 was identified as the clinical commissioning groups, or CCGs, lack of strategic leadership around the SEND reforms. CCGs are clinically led statutory NHS bodies responsible for the planning and commissioning of healthcare services for their local area. Commissioning is about getting the best possible health outcomes for the local population. The most recent improvements in this area have been an increase in staffing, specifically an increase in the designated clinical officers' hours to support timely clinical contribution to EHCPs and offer a single point of contact for health advice. The impact of this is that more children and young people's needs can be assessed and the right support provided. Primary care health professionals have better understanding and knowledge of SEND and local offer and are better equipped to support and signpost their patients to relevant and trusted sources of advice at the right time and place. General practitioners' participation in multi-agency work have a strong GP primary care lead that ensures flow of communication to and from GPs collectively to enable and support participation, enhancing continuity of care for children and young people. CCG leads have improved strategic and operational leadership over the past 3 years and have a true commitment to co-production. Families, in partnership, have received financial support to enable co-production of strategic health priorities. Key concern 3, the poor quality of action plan for the SEND strategy. Key concern 3 relates to the poor quality of action plan for the SEND strategy. The strategy is important as this shapes the direction the local authority will take in relation to SEND services. Our strategy action plan was very quickly strengthened in 2018 as we used the written statement of action for our unwavering focus on improvements to SEND provision for children and young people. Now we have achieved progress against actions needed. We are refreshing the SEND strategy, which will have clear action plans that will further effective identification, a graduated response, preparation for adulthood, effective provision, and be clearly linked to outcomes for children and young people. We've taken the time to listen and hear the voice and opinions of children and young people, their parent carers, and the health and educational professionals' views gathered through the You Said We Did surveys and the local Health Watch surveys. This ensures that the strategy aligns with our service users and all stakeholders have their say. We are also improving the ways we communicate with stakeholders and now have clear communication through SENCO networks, education bulletins, and through the local offer. Whilst delivering the improvement plan or written statement of action, we are developing the 2021-2025 SEND strategy. We have ensured that the SEND strategy is considered alongside other strategies and joining up these with a golden thread running through. This is to make sure our priorities across all areas are clear and purposeful, which can only lead to better outcomes for our children and young people. Key concern 4, lack of joint commissioning arrangements. Ofsted identified a lack of joint commissioning arrangements in our local area. Joint commissioning arrangements must cover education, health through the clinical commissioning group and social care provision for children and young people with special educational needs and disability. These arrangements should be clear about how this provision is commissioned and who is responsible for its delivery. Over the past 3 years, we've developed excellent working relationships between commissioners and worked in partnership on projects to reduce duplication and improve the outcomes for children, young people and families. These relationships have been formalised through the Joint Commissioning Group, which has been refreshed this year and includes commissioners from the Clinical Commissioning Group, Public Health, Worcestershire Children First and Worcestershire County Council. We are realising our ambition to commission collaboratively across education, health and social care, and also across age boundaries 0 to 25, and have recently published our joint commissioning strategy to enable more effective joint working. As an example of the impact of these changes, our multi-agency approach to commissioning overnight short breaks provision led to an increase in suitable provision able to meet overnight needs and increase the choice for families. In another example, the data for our commissioned health services shows what a big impact the focus on this key concern has had. We know that more children are being seen more quickly for speech and language therapy. Key concern 5 relates to the variation in skills and commitment of mainstream schools to provide effective support for children and young people with special educational needs and/or disabilities. Our approach to this key concern has been to A, be really clear with schools about what our expectations are for pupils with SEND, B, support schools, and C, challenge schools. We've established SENCO network meetings, seminars and newsletters. This allows consistent messaging to schools in terms of our expectations of them. Attendance to network meetings is tracked and monitored, and training and support for SENCOs is the linchpin of these meetings. A 2020 Ofsted report noted that training has resulted in staff having a better understanding of how to support children with SEND. SENCOs themselves are saying that sharing of best practice makes them feel confident that pupils are being supported to the best of staff's ability and that the local area is forward-thinking, organised and resourceful in their approach. Delegate Feedback from training provided for leadership in SEND has been brilliant, with 100% saying that the training has improved their professional knowledge and enabled them to develop new skills. We've seen a higher percentage of pupils with an EHCP now receiving their education in a mainstream school. And whilst this is still a higher percentage than the national average, the gap is beginning to close. 37 out of 43 Worcestershire mainstream school inspected by Ofsted between September 2019 and March 2020 received good feedback in relation to SEND provision. School leaders have reported in the 2021 Educational Settings Survey that the SENCO network and newsletters is increasing staff awareness and confidence in how to best meet young children and young people's individual needs. Key concern 6. The lack of suitable provision to meet the identified needs of children and young people with SEND was raised as key concern 6, with Ofsted saying the overall quality of provision for children and young people who have SEN and/or disabilities in the local area is variable, and not all schools are inclusive and work in ways that are in complete contrast to the spirit of SEN reforms. Work undertaken in this area has resulted in an increase in suitable provision in Worcestershire. Several special schools have increased their capacity, with one new mainstream autism base opened already, with 2 further bases planned for January and September 2022. We have seen an increase in the number of first-time EHCP being placed in mainstream and non-specialist provision. The more we improve provision in mainstream schools, then the more places will be available in our specialist schools for those that need them most. In 2018, 71% increase in post-16 learners with EHCP in mainstream colleges and a 51% reduction in the use of ISP. The supported internship programme delivered through MENCAP is a commissioned programme of study where we are securing paid employment opportunities for young people with learning difficulties at the end of a one-year programme of study. The programme secured jobs for 4 young people in year 1 and rising to 20 in year 2. The pandemic restricted MENCAP's abilities to access employers during the 1920 academic year, so we are extending the programme. Case studies have shown how valuable the programme is for young people's confidence and self-esteem. We're keeping the momentum in specialist provision moving, and we are currently consulting on our specialist provision priorities. The suitable specialist provision in Worcestershire, enabling more children and young people with SEND to remain in their community education provision. Key concern 7. Ofsted and CQC were concerned that relationships with parents and carers were fragile. Parents and carers were overwhelmingly negative about their experiences and involvement with the local area. Many felt that they were not listened to by officers and frequently told inspectors that they had to fight to get the right to support for their child. Co-production with parent carers has been fully embedded in our mindset and culture within Worcestershire Children First, Clinical Commissioning Group and Hereford and Worcestershire Health and Care Trust, working with parent carers, education settings and health providers. Parent carers are represented at all levels, from group meetings to board meetings, and have been invaluable in helping us co-produce good quality documents, policies and templates that work for both the local area and for families that use them. Parent carers have reported that things look to be improving, and staff at the higher levels appear to align in mindset more with parent carers than previously. We are actively seeking the opinions of parent carers through our annual Parent Carer Survey, and we use the feedback to drive system-wide improvements, which are then communicated in our You Said, We Did report. We are also seeking the views and feedback of parent carers about specific service areas in order to inform our strategic decisions and service redesign. Communication has been instrumental in repairing fragile relationships with parent carers, and our communications are now planned, strategic and engaging. We've developed our own social media channels, are utilising families in partnership, and Sendias and parent carers signed up to the Children with Disabilities Register now receive direct communication from the service, informing and signposting them to relevant information. We are communicating more frequently and reaching a wider audience. Key Concern 8 revolves around the poor quality of education, health and care plans, or EHCPs, including limited contributions from health and social care and processes to review the quality of the plans. An EHCP is for children and young people who need more support than is ordinarily available through special educational needs support. Back in 2019, a very small percentage of EHCPs were completed within the statutory timeframe. We have increased capacity in the service and quality and timelines have significantly improved. We are really proud to say that nearly 100% of all new EHCPs are now being issued within 20 weeks, compared to 56% back in 2018. And nearly 100% of EHCP decisions have been made in 16 weeks. Both of these have been sustained responses for families and compare to a national figure of 58%, and our success in this area was recently covered by local press. We have co-produced our quality assurance process and parent carers have influenced some decision-making panels. This input means that we are sure that our quality assurance process is clear and easy to understand and demonstrates that we recognise how important co-production is across everything we do. Schools and parent carers have both given feedback on how impressed they have been with the changes to the service and the impact to families and children and young people is that they receive better and more prompt support. The key concern 9 is around the lack of systems to track outcomes for children and young people with special educational needs and/or disabilities. Specifically, young people after they reach 16 who are not in education, employment or training, or who are youth offenders. Over the past 2.5 years, we have developed a SEND data dashboard to analyse, monitor and evaluate key performance indicators around the strategy outcomes for these students. We can see trends in our local area and compare ourselves to national statistics to see how we are performing. We evaluate the performance of local area maintained schools, and this information is used to share good practice and focus conversations and support where schools are not performing so well. We have link meetings with West Midlands Youth Justice and the SEND team to ensure that youth offenders with an EHCP have achievable outcomes and are supported in reaching their potential. We also have improved links between SEND caseworkers and school improvement advisors in special schools, which informs action planning for individual children. The data and better working practices we've developed over the last 3 years means that we have a much stronger evidence base to challenge schools and education providers and provide focused support to those children that need it most, enabling them to reach their full potential. The improvements also mean that we can compare young people's experiences, and our planning is more joined up in its approach. Key Concern 10. Ofsted and the CQC found that there was a disproportionate number of children and young people with SEND that have been permanently excluded from school, and in particular those with special educational needs but no EHC plan. The rates of exclusion were found to be well above the national average and rising sharply at the time of inspection. There has been a 30% decrease in the number of students permanently excluded from 2017 to 2018 to 2019 to 2020. More recent data is not a clear comparison due to the impact of the pandemic. However, we will expect to see decreasing numbers of exclusions based on our work and support for schools. There is now an increased understanding with schools of their statutory responsibilities through attendance at SENCO and head teachers' briefings. We use a school inclusion profile which shows schools their performance in a clear way, and we can see how schools are performing against each other. Again, this leads to more focused support and challenge for schools around exclusions. Schools have reported that communication between themselves and the county SEND team has improved, with clear expectations, and the numbers of permanent exclusions is reducing, so strategies are working. Key concern 11. A local offer gives children and young people with SEND and their families information about what support services and provision the local authority have available in their local area. When Ofsted inspected Worcestershire in March 2018, they found the local offer website was not fit for purpose. Additionally, every local authority must keep a children with disabilities register, and we did not have one. We've worked hard on improving the content and quality of the local offer, and much of the content has been co-produced and aims to be as accessible as possible. We've used our parent carers survey feedback to inform the continuing improvement of our local offer, adding or removing content, including more visuals, videos, and links to more services. We've launched a co-produced Children with Disabilities Register, which we use to send direct communication such as surveys, information and updates to people registered. We have received feedback from parents that this information is very useful for them. Of course, there's no point having a good local offer if parent carers, schools and children and young people with SEND don't know about it. So we've worked with partners to promote the local offer, delivered promotional flyers to schools and doctors' surgeries, and even had a local offer roadshow to spread the word far and wide. We've also launched an e-learning which includes the local offer to increase awareness and understanding for professionals. We also have an approach in place to ensure the local offer is kept up to date and relevant to our families and professionals. The impact of this is that we've seen almost a 20% increase in visitors to the site when comparing 2019 to 2020, and an increase in the number of parent carers reporting that the local offer is easy to use and they're able to find the information they're looking for. A recent survey of education survey shows that professionals in schools now find the local offer to be informative and much improved. Key concern 12. The final key concern was relating to the academic outcomes, behaviours and attendance of children and young people with SEN. Ofsted noted standards at the end of Key Stage 2 and 4 achieved by children and young people who have SEN and or disabilities in Worcestershire, and they are below those seen nationally. We used our data dashboard mentioned earlier to monitor attendance and can see that attendance is improving since the initial inspection, particularly in pupils with SEND support. Our dashboard has been commended as an example of excellent practice to be shared with other local authorities. We've created a school inclusion forum to consider thematic data and concerns and school inclusion profiles, which are shared with schools to improve focus on outcomes for children and young people with SEND. Trauma-informed schools training undertaken by the virtual school has impacted on exclusions and part-time timetables for children looked after. This support and training for schools, in conjunction with the data we collect, has led to real improvements in this area. Local area school Ofsted reports between September 2019 and March 2020 show that 86% of mainstream schools received positive feedback in relation to their SEND provision. The more recent monitoring inspections of schools since the spring term are continuing to confirm this sustained improvement. A local area school Ofsted report noted that leaders are tenacious in following up on absences. Children with SEND are attending school more regularly, and children with SEND are supported well by schools and other professionals, which means they achieve extremely well. As has been summarised in this video, Worcestershire has worked consistently since the 2018 SEND local area inspection to understand, listen and improve and address the key concerns that we can see are having a positive impact on Worcestershire children and young people with SEND and their families. We will continue to spend time listening to service users and reflecting in order to continually improve our service and system. We recognise we have further steps to take to become the best we can be, and we will continue work in these areas. We hope this video has given you an overview of our impact so far. If you'd like any more information or detail about what was covered, then please email sendimprovement@worcestershire.gov.uk or speak to your line manager. Thank you.